Social Determinants of Health. The World Health Organization defines social determinants of health as the conditions in which people are born, grow, live, work, and age, including the health system. There are different levels of action upon the social determinants of health. The effect of local, national, and global policies determines how the health system develops and how a society and the individuals in it deal with illness. Social determinants of health are fragile. They can be shaped by many different factors. Economics, social policies, and politics are the general prototypes of factors shaping social determinants of health. We can talk about some of these relevant factors specifically. The World Health Organization differentiates between inequities and inequalities. Inequities are avoidable differences in the society. On the other hand, inequalities are unavoidable. When we talk about social determinants of health, we aim towards reducing inequities in health inside the country and between different countries. Let's use some examples to understand this better. Michael Marmot, chairman of the Commission on Social Determinants of Health of the WHO, states in the article Social Determinants of Health Inequalities released on the Lancet Journal in 2005 that we can see the inequities in life expectancy throughout the world and at the same time in the same country. Let's take for instance Sierra Leone, where the life expectancy is about 35 years of age, and compared to Japan, where average life expectancy is about 82 years of age. Here we can see that there's obvious differences in economic opportunities which may make health inaccessible to a certain population. Social gradient is important here to realize that the lower the class, the more the disease. For instance, in the United States, there is a difference of approximately 20 years between the most and least advantaged populations, as stated by Michael Marmot. This shows inequities in and between countries. Another important difference to understand social determinants correctly is access and presence. These are not synonyms, as a society might have free primary healthcare but not distributed in a way that everyone can benefit from it. The existence or presence of primary healthcare in a country is a good social policy, but presence is not equal to access. If a population has to travel 20 hours to reach a hospital that can give them the treatment they need, that complicates healthcare and perpetuates the social gradient. The WHO states in the meaning of social gradient that the poorest of the poor around the world have the worst health, and that this happens throughout the world, in low, middle, and high-income countries alike. What about primary health care? The Alma Ata Conference, signed in 1978, states that primary health care is essential health care based on practical, scientifically sound, and socially acceptable methods and technology, made universally accessible to individuals and families in the community through their full participation, and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. Even in 1978, when this declaration was signed, the idea of the impact of society on primary healthcare was present. The declaration even states that primary healthcare reflects and evolves from the economic conditions and social-cultural and political characteristics of the country and its communities. It should not cause surprise that health and health equity are affected by policies, even if it is not the actual aim of these policies. Remember that social policies themselves, politics, and economics can shape social determinants of health, and therefore health systems as well. Social position and hierarchy at national and local levels are shaped by global politics, issues, and realities. This also relates to the organization of populations based on factors like income, race, and education, which therefore affects accessibility to health and their living conditions. We can understand that health inequity in itself causes the unequal distribution of power and wealth, which therefore also stratifies health outcomes. Although this is important, we need to understand social position as the key concept in social determinants of health actions. For this, we need to understand structural determinants as those that are rooted in the society or defined by social stratification and tend to divide the society. Intermediary determinants are those that connect the structural determinants, social structures, and circumstances. So how can we point towards health equity? We do this through the hard, everyday work of people who aim to change the unfair distribution of resources. So never forget, in order to build an integrated and strategic approach on social determinants of health, the aim should be to reduce inequity, to make primary healthcare accessible to disadvantaged groups who are the ones that need it the most. We distribute our efforts to try to shape political, economical, social, and cultural realities in local, national, and global levels to make primary healthcare present and accessible for all of the population. Let's take the steps to make a change.